Hi guys, today we're going to be doing injections. So we're first going to start with mixing insulin, but that's subcutaneous. So it's going to be, the syringe is going to be about a milliliter. We're going to use 1 ml. Normally it's in units, so it tells you. It's going to be a gauge of 25 to 30, and then the length is going to be 3/8 to 1/2 inch. And then for intramuscular, which is this one, the syringe is going to be 1 to 3 mils, which I believe this one is a 3 mil, yeah. And then the gauge is 18 to 24 with the length of 1 inch to 1.5 inches. So we're first going to start with mixing insulin. So the irregular is clear, but the NPH is cloudy. So we're just going to agitate it.
I'll take one for fast.
Now I'm going to look at my MAR here, and we are going to make sure we have the right patient, which is going to be Willie, and then the right drug, which is his insulin, the right dose. So we're going to do 10 mils of regular, 15 of NPH. The route is going to be injection. It's going to be subcutaneous, so this needle. And then the right time, we're going to say it's right after lunch, so noon. Okay, I'm gonna hand hygiene. I don't know why I actually did it, but we're gonna hand hygiene. I'm gonna look at the insulin, make sure it's good with the MAR, check the expiration date, make sure it's not expired. Okay, there we go. Okay, so we're good. Okay, I'm gonna don my gloves, because I don't like touching alcohol without my gloves on. Okay, and then I'm going to take an alcohol pad and I'm going to clean the top of the regular first. Set that down, I'll throw that away, get a second one. I'm going to clean the top of the NPH. And this one is still agitated, so we're good. I already have my gloves on. Okay. I'm going to pull out 10 units of air, and I'm going to put that in the NPH. Just going to blow it. And then this one I'm going to do 15. Let's uneven there. Okay, and then I'm going to inject it into the regular. And because I already injected it, I'm going to pull out the same amount. And there is a little air bubble, so I'm going to flick it.
You go next.
I did it air bubble
twice,
out.
and I didn't do the third time. And then
Killed him.
I killed him.
Okay, then we're going to do the NPH. I like to think of it as RN. And then I'm going to pull out. So it should be a total of 25 units. Okay. And I want to make sure there's no air bubbles. And it looks like there isn't, but just to be careful, we'll just push the syringe. Okay, and we're good. Okay, and then I'm going to do the scoop method to put the cap back on. I would label the syringe and then I'd take it to the client's room. Now we're going to do this, and we're also going to do intramuscular. So I would take off the gloves, I would hand hygiene, and then I put new gloves on. But for the purposes of this video, I'm just going to keep the same gloves on. Now for the intramuscular, we can either do a deltoid position, we can do the vastus lateralis. So the deltoid is 2 fingers and it's down, vastus lateralis is in the middle of the thigh, and the ventrogluteal is like a V from the right of the iliac crest, okay? So I'm going to put on gloves, I'm going to pick a site, I'm going to do the deltoid for this video. But before I do anything, I'm going to open this up. I'm going to clean the top of this. Okay, I'm going to take this off. Don't want to activate that yet. Okay, we're going to do 0.3 mils.
2 o'clock, are you ready to go, Sarah?
She's 2 o'clock.
Is she? Yeah, I'm ready.
I'm gonna put it in, inject it, and then I'm gonna put in the 3 needles again. I'm gonna make sure there's no air. Looks like I got none. Okay, and then I'm gonna recap the needle using the scoop method again. Clasp it on. Okay. And then I would take off these gloves. I would head to the patient's room. Okay, I'm gonna make sure I have the right patient, so I'm gonna ask him for his name, his date of birth. He's gonna tell me. I'm gonna check his MRN. I'm also gonna look at the little wristband, verify with my MAR. I'm gonna make sure I have the right medication, so the insulin, and then this is gonna be the flu vaccine. I'm gonna say, okay, I'm gonna give you your insulin, and then I'm gonna give you your flu vaccine. Is that okay? He's gonna say yes. So for the insulin, we're gonna use this little thing right here. So I'm gonna open this, and I'm actually gonna squirt it out. Okay, and then we'll just do air, 25 mils. Okay, so I'm gonna pinch the skin. And you can either go at a 45-degree angle or a 90. This, we're gonna do 45. I'm gonna hold it in, leave it in for 10 seconds. And then I'm gonna pull it out. And then I would recap the needle using the scoop method. And that is the insulin. And then for the intramuscular, I would take the gloves off, put new gloves, and then I would clean it, his site. I would do it, I would clean it for 2, and then I would take the cap off, and I'm gonna use the Z-track method on him. So I'm gonna go like this, I'm gonna pull this out. Okay, I'm gonna squeeze the skin, I'm gonna poke it in, and then I'm gonna squeeze it in. And with the Z method, when I leave it in for 10 seconds, after the 10 seconds, I'm gonna pull the needle out, I'm gonna release it, and then I would activate the safety, but because of the video, I'm just gonna scoop the needle back up. That way we can save the needle, put it on there. Okay. I would remove my gloves, hand hygiene, and I already did the subcutaneous, so that's it.